all you care warriors. This is Sofia, caregiver and geriatric social worker. I wonder if you've been thinking about mechanical ventilation and whether it would be the best choice for you or your parent in the future. Not quite sure if it should be included on your advanced healthcare directive? Well then, you don't want to miss all the facts about mechanical ventilation in this decision assistance video coming up right after this. Welcome to part 3 of my advanced care planning series. I hope you saw part 1 all about advanced care planning and part 2 about CPR decision assistance. If not, I'll put links to them in the description below. This video is all about mechanical ventilation and decision making. Again, I must give you fair warning that this is really a serious topic and not everyone's going to be able to listen to what I have to say or like what I have to say. But I have to give this information because I've seen too many people just make decisions too quickly on their advanced healthcare directive and on the spot in the hospital without having a good full understanding of the choices and the ramifications of their decisions. This full understanding is necessary as you go through the advanced care planning process. I have to make it super clear that I'm not a doctor or a nurse, but I've worked 25 years in the healthcare field as a social worker, and I'm often the one called on to have these difficult conversations with families about medical decision making. I strongly feel that people must have accurate information, as hard as it might be to hear, in order for them to make the best decisions. The information in this video about mechanical ventilation will help you with the advanced care planning process, completing your advanced healthcare directives, and will help you if you're ever faced with having to make decisions right on the spot in the hospital. Today I'm going to talk about mechanical ventilation, also called being on a breathing machine or a vent, and how it might help a patient, how it might harm a patient, and some additional things that you need to consider. Don't forget, you should always talk to the doctor about the risks and the benefits of mechanical ventilation that are specific to you or your loved one's situation and medical circumstances. First, the facts. Ventilators are machines that help a patient breathe when they can't breathe on their own, and the machine forces air into the lungs. They are considered life support machines. They can be used temporarily or permanently. Usually in the beginning, a tube is put down into the mouth and down into the throat, and this is called intubation. Sometimes this can be very uncomfortable, so medications are given to keep the patient sedated and more comfortable. If the ventilator will be needed for more than about 10 days to 2 weeks, then the medical team may decide to make the tubing more secure and more comfortable by doing a surgical procedure to make a hole directly into the neck, into the trachea. The tubing from the ventilator machine will now go through the throat and not through the mouth. This procedure is called a tracheotomy, and the hole is called a tracheostomy. People with a tracheostomy often are unable to speak without special help because when the exhaled air does not go past the vocal cords. Sometimes the use of a ventilator is temporary, like during a surgery or during a sudden severe illness or after a serious injury. Sometimes when a person has a lung disease such as COPD or asthma or emphysema, pneumonia, they may need to use a ventilator just temporarily to get them better and back to their healthier state. Other times, long-term or permanent ventilator support might be needed if the patient is extremely weak and their lung muscles don't work normally anymore. Often, being in a coma or when part of the brain that controls the lungs is damaged, long-term ventilation might be needed. Also, diseases of the muscles, nerves, or injury to the spinal cord or severe lung damage might cause someone to need a permanent ventilator support. Unfortunately, some patients need to be on the breathing machine for years. Use of a mechanical ventilator can be very helpful for a lot of people who have a sudden illness because it helps to keep them alive while the doctors are trying to treat and cure them. It helps to supply oxygen to the organs, including the brain. A ventilator can also support your breathing during surgeries or other procedures and can allow time for a person to improve after a trauma or sudden illness. and helps a person live longer. Use of the mechanical ventilator can also be harmful to some patients because they're more prone to getting lung infections. Use of the ventilator can also cause damage to the lungs and make the breathing muscles weak. So the longer you use the breathing machine, the harder it might be to ever get off of it. Often, people on the ventilator also can't speak or swallow, which cause other complications. Not directly related to being on the ventilator, but common things that might happen in people on long-term ventilators might be the need for long-term placement in a specialty nursing home, skin issues or wounds that sometimes occur in a patient who's primarily bedbound, as well as contractures of the limbs from being bedridden for a long time. If they're unable to swallow because of the ventilator, then they might need to also be fed through a tube that's placed directly into their stomach or intestines, and I'll talk more about that type of artificial nutrition in part 4 of this series. The people who can be helped the most from a ventilator are those who were the most healthy before they became ill and who have the strength to recover. Those who only need the ventilator for a short period of time, like a few days or a week or two, and those who feel that they can have an acceptable quality of life while living on the ventilator long term, such as a younger person with a spinal cord injury, they could be greatly helped from ventilator support on a long-term basis. The people who are helped less from the use of a ventilator are those who might have a terminal illness such as advanced cancer or Alzheimer's disease, or those with advanced or terminal illness from heart, lung, liver, or kidney failure, because the use of a ventilator is not going to cure those pre-existing conditions. Those who are really old, weak, and frail are also likely not to get as much help from the ventilator. People who might choose to try mechanical ventilation are those who are able to get over their current health condition and get better and who have no other medical problems or complications. Also, a person who values staying alive as long as possible, regardless if it might cause other medical complications, might also choose to use a ventilator. But people who might not want to try a ventilator are those who want to avoid being in a hospital on a long-term care basis, those who don't want to be hooked up to a machine, or those who state they don't want to be on life support. And anyone else who doesn't want to risk the harms from being on a long-term ventilator also may consider saying no to that type of support. You must talk to your doctor and healthcare team about the specific circumstances of your or your parents' health situation. Ask about how likely is it that the ventilator can help to get you back to your prior level of health or ability. Ask what the life expectancy would be on the ventilator or without it. Ask whether the doctor thinks it would be needed for a short period or a long period of time, and what life would be expected to be like during and after the ventilator. If your parent is in the hospital, you, your parent, and the doctor might decide to try the mechanical ventilator for a certain period of time to see if there's any improvement. If not, some people choose to stop the ventilator and allow nature to take its course. While this is a difficult choice, it is as legal and ethical as never having started the ventilator in the first place. Stopping the ventilator is not considered euthanasia, which means actually giving a patient something that would cause their death. There is no right or wrong answer when it comes to agreeing to mechanical ventilation, as long as that decision is made with full knowledge of the choices and possible outcomes, and when the decision is based on the values and opinions of the patient. You are now more informed about the use of mechanical ventilators. I hope this information will make you think about what you might want for yourself and for your family members if you're ever faced with needing to make a decision. You can also use this information during your advanced healthcare planning process and in the completion of your advanced healthcare directives. It's much easier to follow through with a person's wishes when they've had the opportunity to write them down or at least talk about them with someone close to them. In my opinion, not knowing what a person would want for themselves during a medical crisis is just about the hardest thing for the family members that I've ever met. In the next video in this series, I'll be talking about decision making regarding artificial nutrition and hydration. And in the final video, I'll offer some advice on how to talk with your parent about these really tough decisions. If you found this video even a little enlightening or informative, then please hit the like button. And if you don't want to miss any videos in this important series about advanced care planning or future videos about everything senior related, then make sure you subscribe to my channel. I thank you for watching, and I'll see you next time.